Cancer. Overview and types. Cancer is a group of diseases characterized by the uncontrolled growth and spread of abnormal cells in the body. These abnormal cells, known as cancer cells, can invade and destroy healthy tissues and organs, leading to a range of health problems. There are many different types of cancer, each with its unique characteristics, risk factors, and treatment approaches. Here's an overview of cancer and some common types. 1. Carcinogenesis and risk factors. Carcinogenesis. Explanation of how cancer develops from normal cells due to genetic mutations and alterations in cell growth regulation. Risk factors. Identification of various factors that increase the likelihood of developing cancer, such as smoking, excessive alcohol consumption, exposure to carcinogens, family history, age, and lifestyle choices. 2. Breast cancer. Definition. Overview of breast cancer, which develops in the breast tissues, typically in the ducts or lobules. Subtypes. Description of different breast cancer subtypes, including hormone receptor positive, HER2 positive, and triple-negative breast cancer. Diagnosis. Explanation of diagnostic methods like mammograms, biopsies, and imaging scans used for early detection and diagnosis. Treatment. Overview of treatment options, including surgery, radiation therapy, chemotherapy, hormone therapy, targeted therapy, and immunotherapy. 3. Lung cancer. Definition. Description of lung cancer, which forms in the lungs and is commonly linked to smoking. Types. Differentiation between non-small cell lung cancer, NSCLC, and small cell lung cancer, SCLC. Symptoms. Common signs and symptoms, such as persistent cough, chest pain, and difficulty breathing. Diagnosis and staging. Explanation of diagnostic techniques, such as imaging tests and biopsies, as well as staging procedures to determine the cancer's extent. Treatment. Overview of treatment options, such as surgery, radiation therapy, chemotherapy, targeted therapy, and immunotherapy. 4. Prostate cancer. Definition. Explanation of prostate cancer, which affects the prostate gland in men. Risk factors. Identification of risk factors, including age, family history, and ethnicity. Screening. Discussion of prostate-specific antigen, PSA, testing and other screening methods for early detection. Treatment. Overview of treatment options, including active surveillance, surgery, radiation therapy, hormone therapy, and chemotherapy. 5. Colorectal cancer. Definition. Description of colorectal cancer, affecting the colon or rectum. Screening. Explanation of screening tests like colonoscopy and stool-based tests for early detection. Treatment. Overview of treatment options, including surgery, radiation therapy, chemotherapy, targeted therapy, and immunotherapy. 6. Skin cancer. Types. Description of common types of skin cancer, such as basal cell carcinoma, squamous cell carcinoma, and melanoma. Risk factors. Identification of risk factors like excessive UV exposure, fair skin, and family history. Prevention. Tips for sun protection and skin cancer prevention. Treatment. Overview of treatment options, including surgical removal, radiation therapy, topical medications, and immunotherapy. 7. Leukemia. Definition. Explanation of leukemia, a cancer of the blood and bone marrow. Types. Differentiation between acute and chronic leukemia and various subtypes. Symptoms. Common signs, such as fatigue, frequent infections, and bruising. Diagnosis. Description of blood tests and bone marrow biopsy for diagnosis. Treatment. Overview of treatment options, including chemotherapy, radiation therapy, targeted therapy, and stem cell transplant. 8. Lymphoma. Definition. Overview of lymphoma, a cancer of the lymphatic system. Types. Differentiation between Hodgkin lymphoma and non-Hodgkin lymphoma. Symptoms. Common signs like enlarged lymph nodes, fever, and weight loss. Diagnosis. Explanation of imaging tests, lymph node biopsy, and other diagnostic procedures. Treatment. Overview of treatment options, including chemotherapy, radiation therapy, targeted therapy, and immunotherapy. These are just a few examples of cancer types, and there are many others affecting different parts of the body. Each type of cancer may require a specific approach to diagnosis, treatment, and management. Early detection and timely intervention play a crucial role in improving the prognosis and quality of life for cancer patients. It's essential to consult with healthcare professionals for personalized information and guidance related to cancer prevention, screening, and treatment.